Hi everyone, Dr. Remy from Pain Free and Fit and Posture Size. Today we're going to be going over a very simple, low-tech, home-based exercise program for you to help get over your patellofemoral pain syndromes. Hope you enjoy. So any effective corrective exercise program for any area of the body, including the knee, is based on having a specific analysis of your unique posture and mechanical issues. If you're not identifying what your unique posture and mechanical issues are as a unique individual, then any type of tear sheet or generic exercises you're going to be doing for your knee will probably only be strengthening your mechanical dysfunctions and placing more stress ultimately on your knee, which is going to aggravate your pains. So a lot of you out there that have done classic rehab between squats with the ball between your legs, or wall squats, or trying to do lunges or VMO work with either clam work or 4-point hip flexion, extension, ab and abduction, and haven't gotten the results, it's most likely because you have not addressed the unique issues that are underlying the root cause of why your kneecap is mechanically stressed. So to really understand your full mechanical issues, it's beyond the scope of this video, but I invite you to go to either the Pain Free and Fit or Posture Size websites where we have a full body analysis. You can learn about all your posture and mechanical issues there, and then implement that information into the following simple low-tech rehab home exercise program to help with your knee pain. So let's begin by understanding that the patellofemoral joint, the kneecap sliding in its normal groove, is affected by hip and foot mechanics. Rarely is it just a problem at the knee itself. Sometimes it's actually related to an opposite shoulder mechanical problem, because there are muscles and fascia that run from our opposite shoulder down across our body and diagonal and affect the hip and the leg on that side. What we're going to do today is we're going to go over a couple simple concepts in a very simple tiered exercise program using what's known as your RPI, or reverse posture isometric. And again, if you have your full body analysis, you'll know how to tense or correct all of your postural mechanical issues. But the short version of that today is going to start by learning what we're going to do with our knee. On the side that we have our problem and our pain, the typical mistake is that that kneecap is going to be sliding out and up. So if we place our fingers on both the inner and outer aspects of the kneecap and straighten our knee, our typical finding will be that that kneecap slides outwards. So to help correct that, the RPI, or reverse posture isometric, is to tense the kneecap inwards. Okay? Now when I say tense, I don't mean actually move the whole leg or bend the knee inwards, but simply tense it as if you're resisting a force trying to push it out. So there's no net motion here, just tension. Beginners should be aware that it's okay to feel the inner thigh muscles when you first try to do this, but we want to try to move away from the inner thigh muscles to localize it just to the kneecap and not the whole thigh, because if we rely on tensing those inner thigh muscles, we make the same mistakes that some of these rehab exercises that use the ball in between the legs does, which is it weakens the hip muscle. As the hip abductor muscles tense, the hip abductor muscles on the outside weaken. And we don't want that, because we're going to learn in a second that hip mechanics, we want to strengthen our hip abductors. So if we just exert a little local tension with our kneecap moving in, and to help with that, you could actually push your finger lightly against your kneecap so you have a little brace to push against. As you maintain that internal tension, we're going to straighten our knee. And when you do that, you'll notice that you'll have a better tracking or movement of your kneecap, because you're going to feel a little bit more tension on the inside than you did if you did not tense that kneecap in. Typically when we straighten, you'll feel more tension moving out into your finger on the problem of the patellofemoral joint pain syndrome. So as we maintain that tension in, I want to augment that by something going on in the foot, which is typically with these patellofemoral pain syndromes, the foot likes to pronate, meaning the heel likes to turn inwards on its inner edge. So we're going to associate that correction with the kneecap tensing in by tilting the heel down on its outer edge, and we're going to complement that with the big ball of the front of the foot tilting down on its inner edge. So the back of the foot is turning out, the front of the foot's turning in. Foot has a little twistability to it with multiple joints throughout it that allows for that. When you do that, you're going to notice that it's going to help to keep the two corners of the heel balanced, the two corners of the forefoot balanced, and it's going to really light up or allow you to grab that VMO muscle, that inside kneecap muscle, to track or tense the kneecap so it's no longer sliding out into your outer finger as you straighten your knee, but rather in so that you're feeling a little equal pressure from your inner and outer fingers. Now we're going to take that exercise. You can practice it for 2, 3, 4, 5 reps at a time, every half hour, hour during the day, for the first few days or so until you feel confident that you can keep your foot balanced and your kneecap tensing in. Once you feel like you're pretty proficient at that, we're then going to use that to integrate it into a standing exercise. And what we're going to do is we're going to use a split stance. We're going to have one leg forward and one leg back. We want our problem side to be forward, but we're going to learn that we can do that with the back leg as well. We're going to use the same corrections that we just talked about, that tension in, the heel down on the outer edge, the big ball down in the inner. And as we do that, we're going to practice moving our hip downwards on the standing side. You see that? The typical mistake with weak hip abductors that contribute to patellofemoral pain syndrome is that the hip likes to scoot up, and that happens the deeper we lunge or go into a split squat. So we want to swing our lead hip down and our back hip up, okay? So we create an equal level hip. And we're just going to get used to isometrically holding that position. You'll notice as I'm doing that, I'm avoiding allowing that painful knee to travel forward, okay? When I get into that position, I'm bending straight down. My knee is not moving forward at all. It's well in back of the toe line, if you draw a line straight from your toes, and it's allowing my hips to move back and down. That puts more stress on my glutes, as well as my hip abductor muscles. That takes tension away from my kneecap, okay? After you get used to that, you can practice that again, maybe a couple times a day. Don't go crazy, maybe 10-second holds. When you get used to that and feeling comfortable in the balance of that, we're then going to use it for the final phase of our home rehab program, which is to move with that. So what I mean by that is going back to that position, we're going to hold all those corrections as we learn to come up and down. Now, the lower you go, the more that kneecap wants to slide out. You need more tension in. The lower you go, the more the heel wants to fall in on its inner edge. You need a little more tension out. Not moving it out further, but tensing and holding, resisting the tendency for it to fall in. The lower you go, the more hip down pressure you need to avoid the hip coming up. And the lower you go, the more you want to keep your pubic bone anchored or turned in towards that lead leg, because its tendency will be to fly away, which then again aggravates tension from our iliotibial band down to our knee. So we want to keep that pelvis straight by turning the pubic bone in and the hip down. And that's a really tough exercise. Beginners will have enough problem just using the top inch of that motion, but as the weeks and months go on, you can get better by moving lower down. That exercise is a strengthening exercise, so we don't want to do that every day. Here's where we switch to practicing it every other day, and we count how many repetitions we do. Maybe we start with a couple sets of 5, and we add 1 or 2 reps every other day, building up the strength. And the final progression or tier of this exercise is the one-legged squat, where we're going to be standing on one leg, using the same corrections of heel, foot, knee, and hip as we come down and come up. From the back, again, the mistake is the lower we go, the more we want to hip height, we want to hold that down, and we want to keep our ribs from leaning into that standing side as well. We want to have equal ribs and equal pelvic heights throughout that. And again, you'll notice following the same principle, as I come down, I'm keeping my knee from moving forward. It's a buttock back exercise. And again, from the beginning, you may only be able to hold proper form mechanics with an inch or so of motion. But as the weeks go on, every other day, you're including this exercise and building up reps. You're always focusing on form being held as more of a priority than the number of reps you do, because we don't want to strengthen dysfunction. And as time goes on, you'll be able to get that one-legged squat down to a lower level, maintaining all those corrections at the foot, at the knee, and the hip. So that's a nice low-tech approach to patellofemoral joint pain. Practicing that over several weeks, over several months, gradually decreases the stress on that patellofemoral joint and trains you to use all three of these integrated body regions together to help prevent your pain from occurring. If you'd like more videos on these subjects, such as pelvic, knee, and foot posture, biomechanics, and corrections, we have a ton of them on our websites, or you can subscribe to our channel. If you would like to help us share this crucial information with others, give us a thumbs up, a like down below. We'll get this information out to help more people with this patellofemoral pain. And of course, if you have any questions, please leave a comment below. I'll do my best to answer. Hope you enjoyed this short little at-home, low-tech approach to patellofemoral joint pain, and I hope it helps you.